Hello, my name is Gamaro Sanchez. I am a registered respiratory therapist for URS Medical. What we're going to do is going to show you some demonstration videos on some of the items that we do use here at URS. In general, these videos are a form of resource, and it's how we do most of our general setups. If you do ever have any questions, feel free to give us a call and we'll do what we can to help. This section will be on the pulse ox. A pulse ox is a non-invasive, portable machine that reads heart rate and pulse oximetry. We will show you how to do the setup and how to make the readings and how to set the parameters. So the pulse ox, like I said, is a non-invasive monitoring machine that's portable. The indications for the pulse ox are set by your doctor. There aren't really any contraindications, but there are precautions. The precaution is that your waves may be altered by motion, by skin pigmentation, or if there's nail polish, but for pediatric patients you really don't have to worry about that. So the items that we would be using is the pulse ox. In this case it's a RAD 97, the cable that connects to the pulse ox, and the pulse ox probe that connects to the patient. So the items, the way they'll connect is we'll connect the cable to the pulse ox machine. You line up the connector, make sure it snaps. For the probe that goes to the patient, you would open up the covering here, would line up the arrows would connect, and you would close this covering. Once you've connected everything, you'll hold the home button and it will illuminate. Once it turns on and everything's connected, you'll get this infrared light on the probe, and that means that it's searching for a signal. Before we place it to the patient, we need to set parameters, which again would be prescribed by your doctor. So when you initially turn it on, you'll see this screen. Depending on the age of the patient, we typically have pediatric. You just push OK. Again, your parameters will be set by your doctor. Let's just say in this case, they want the low on the saturation to be 90. Click OK. Back arrow, back arrow. And they want your heart rate, the PR stands for heart rate, to be 150. Okay, and 60. Okay. So those two are set. This is an infrared reading. This is highly sensitive to motion, so we usually turn that off because most of our patients move a lot. So you just push the low. Go to off, push OK, back over here, back arrow. So this is the setup, the alarm, this is the alarm, this is the pulse tone. Usually turn that off, push back arrow. So this is the setup. This number you really won't have to read that often, so what we'll do is hold it down like a screen and bring it down. And now you just have your two numbers. So when you connect it, if you were to look here, you'll see there's an infrared light searching for signal. That means it's working. Say you connect all this and this light is not working, your cable could be bad. What we'll do is switch this same cable with the infrared light out, put a new one. If it's still out, then it means that your cable that connects to the probe is out. Remember, there's wires in here, so those wires can break. Other forms of troubleshooting is your signal on your machine can be way off. Also remember that if the patient's moving, it can mix with the signaling. So to make sure it's a good signal and that this is well placed on the patient. So for an infant, you would take it, you would go above the big toe, then for a light would go underneath, you would wrap it around, making sure that the cable goes away from the toes, and then you're able to put a sock over it, and that would be a good position to have it. This is a general form of placing and using the pull socks. But again, if you ever have any questions, feel free to give us a call and we'll do our best to help you. Thank you.